Good morning, board members and public. Thank you for allowing me to present today. We're listening to your feedback and we're hopefully ready to provide some clarity to the things that we've been hearing and some of the things that are floating around in the community. And thank you to Doug Archer from Mark Twain Medical Center for joining us and providing an update on the things that they're doing as well. I'll run through a few things pretty quickly here. Last week, we did activate the dashboard. So that is now up and running on the COVID website for the county, and that will have the same numbers that I'm giving you here, which is our total case number right now is 1,240 total cases. We have 76 active cases. We've had 23 fatalities and 1,141 people recovered. The county status is widespread, and we are still in the regional stay-at-home order for the San Joaquin region. To date, the number of vaccines, the total number of vaccine shots that have been put into arms is 919. 769 of those are the first round, and then the second round, about 150, and there are more being done today. Now that includes the vaccines that Public Health has done, the vaccines that Mark Twain has done leading up to today, and the vaccines that CVS has done. Which brings me to something else that I need to clarify today, which is we've been getting a lot of questions about the structure of the tiers, understandably, and why certain residents in long-term care facilities have not already been vaccinated. And something that I have not said in my previous meeting that I did last week, but that I've gotten a little bit of clarification on. So the long-term care facilities, which includes assisted living and skilled nursing, places such as Avalon Healthcare, Foothill Village, Watch Goldstrike, St. Andrews Manor, and Penley Care Home. Those facilities were contracted, well, the facilities weren't contracted, I apologize. The Federal Health and Human Services did a contract with CVS and Walgreens nationwide to vaccinate facilities just like the ones that I mentioned. And so when the feds engaged in that nationwide contract, we understand that those facilities are in our community. CVS and Walgreens, and obviously it's CVS for our county since they're here, they are equipped to be able to go to those facilities where the residents may not be able to be transported to somewhere like Mark Twain to be vaccinated. So it's great that that contract is in place. Unfortunately, what we don't know is why has, our understanding is the first dose has already been administered to Avalon Healthcare, but we're awaiting clarity from the state and from CVS, and I believe that the California Department of Public Health is looking at this statewide as well to get more clarity from CVS and Walgreens about what is the schedule and when will these people be vaccinated. So that's a question that I'm receiving a lot of because understandably, community members are scared and frustrated when they start hearing about us vaccinating people prior to long-term care facility people being vaccinated. And just understand that we're trying to get clarity on that as well because those contracts were given at the federal level to CVS and Walgreens. So if we find out more, if we get a response, and we did reach out to CVS late last week, if we get a response, we'll try to make that public, but right now we're still awaiting clarity on that. Okay, rewinding. As far as the vaccines that we're doing, I also have another point of interest for the community, something that's been coming up over the weekend with a news story that broke, and we did put this out on the website yesterday, but I want to take another opportunity to say that there was a report of a higher than usual number of possible allergic reactions reported to the California Department of Public Health from the Moderna lot 041 L20A. Again, that's the Moderna lot 041L20A. I want to make sure that the public knows this lot number has not been used by Calaveras Public Health or Mark Twain Medical Center as of this time. And I see Mr. Archer shaking his head in agreement. Out of an extreme abundance of caution, Calaveras Public Health and Mark Twain Medical Center have put a hold on the administration of vaccines from that Moderna lot until the investigation by the CDC, FDA, Moderna, and the state is complete. We will provide an update as we learn more. I will say that we do have some of those vaccines, so they're being held, but obviously that means that our inventory, at least for the time being, could be lower than what we had hoped. Okay, a lot of stuff to cover, so bear with me. Doug, maybe I should let you jump in at that point. You have an update you want to give on your guys' appointment setting and the things that I've been hearing so much about, please.
Yeah, sure. Thanks, Sam. Thanks to the public and to the supervisors for the opportunity to clarify a few things. In our world of constant information, there's a lot out there. So we launched at Mark Twain Medical Center, we launched our clinic for vaccines yesterday. We hosted it down below the hospital near our cancer center. We provided 110 vaccines yesterday. As Sam mentioned, we also have some of that lot of Moderna vaccines that we pulled from our inventory and sequestered until we get better direction. But that definitely lowered our inventory, obviously. So we're continuing our vaccine clinic operations this week. We're not doing anything today, mainly because our cancer center has other operations happening. But we will be back tomorrow and Thursday. And then if we have enough vaccine, we'll continue on Friday. And then we will take a pause until we can confirm shipment of more vaccines. So not only has this Moderna lot impacted our local inventory, but to the tune of, I think, 330,000 doses has impacted the nation's inventory of vaccine. So, so we're working through that. We made a deliberate move with our clinic that we were not going to schedule patients unless we had the vaccine. So we're not going to do a first come, first served type of a format. So we will only schedule up to the amount of doses that we have. We did 110 yesterday. Tomorrow we're planning to do 200. And then on Thursday, we're planning to do 250. 250 is probably going to be about the max that we want to do in a day. As you can imagine, that's a lot of choreography. I would like to give a special recognition to our clinic director, Marina Boland. She is the mastermind behind our process at the clinic. And if you had any feedback from community members from yesterday, all the feedback I have is really positive. Pretty seamless, and generally people were there for maybe 20, 25 minutes in and out with their vaccine. So just quick recap, really the future success of our vaccine clinic is 100% tied to inventory and supply. I have heard that Moderna and Pfizer have ramped up operations and are, with the support of the government, producing vaccines 24 hours a day, 7 days a week now. The rumor is, and I don't have this confirmed yet, but they feel that they can kind of fill that gap, that backlog in inventory in the next week and a half to 2 weeks. So I guess for some support, for some help here, I can imagine the public getting very, very concerned when the clinics aren't happening next week. And when the news stories come out about limited supply of vaccine. If we can just kind of help calm everyone down, I do believe vaccine is coming. I think we're just going to have a little pause here for the next week and a half to 2 weeks. So bear with us. We also just about melted our phone system on Friday when we went live with our scheduling number. Within 15 minutes, we had 984 voicemails within 15 minutes of putting that number out there. So far, we're not just going to go dark with the inventory issue of vaccine. We will continue taking those calls, and we will continue putting people on a wait list. And as soon as we have the vaccine, we will ramp up operations and start calling people to get them scheduled again. So the other important note would be, we've got a really good team doing this stuff, both sides, the county and the hospital. I know there's a lot of anxiety around the situation, but if you've called us and you've left a message, give us some time to call you back. We've had probably 3,000 calls come into the hospital, maybe 3,500 calls, and it's probably only 1,000 people. So each one's calling us 3, 4, 5 times. So just bear with us. And we will be going live. We're working on the kind of the details and building of it, but we will be going live hopefully next week with an online scheduling format, which will be tremendous for all of us. So I'll keep you all posted on that. We'll send that out via all the forms of communication, Facebook and Pine Tree and Calaveras Enterprise and every other form. Of course, working with the county to get that message out as well. So those are the updates I had. Happy to field any questions or feedback.
Thank you. Thank you, Mr. Archer. Are there any board members that have any questions? Mr. Garamendi? Oh, Mr. Garamendi had his hand up.
I'll defer to Ms. Cowley.
So there we go.
I mean, the question probably goes to Mr. Archer and to Mr. Leach. Is it that we do not know how many vaccines we're going to get till it shows up on our doorstep? Or do you know that next week you're going to be getting an additional 300 on top of the 500 you have?
We do not have any shipments planned for next week. We have our requests in with both supply chains. I mean, it's one big supplier, but we have an avenue with our partnership with the county, and then also through our large organization, Dignity Health. We have called all cars. Anybody and everybody that will listen to us, we have an order in. It's not so much that we know what we have when it shows up. We do get a little advanced warning, but generally that's 2 to 3 days. And I don't know, say for instance, if we put in an order for 1,000, we can't guarantee we're going to get 1,000. We may get 300, we may get 500. It's especially right now until Pfizer and Moderna can really ramp up and meet the supply demand. And losing 330,000 doses or sequestering those doses didn't help.
So I'm sorry, Mr. Archer.
I hope I answered your question.
Yeah, I think it's sort of a fuzzy area. So Mark Twain gets an allocation from Dignity, and you also get an allocation from the county?
Yeah. I mean, basically, we partner with the county. We're kind of, I guess, maybe define it as a subcontractor with the county. So we'll help them distribute what vaccines they have, but we also get a supply from Dignity Health.
Okay, and the protocol is when you get it, you return phone calls to schedule appointments.
Absolutely.
Thank you for that. Thank you.
And Supervisor Callaway, just to clarify, you know, some of those doses that we get in are also second doses.
Yeah, okay. So I have another question, Mr. Chair, if that's fine.
Absolutely, Ms. Callaway.
Mr. Leach, I think, I guess what the next question I would have regarding the priority of when do we move, do we wait till all the 65ers are done before we go to food and ag and the education? I know the schools are being done this week. And is that from the allocation that public health receives? And at what point will we move to the food and ag? Thank you.
I don't yet know when we're moving to food and ag. Yes, we gave an allocation for the schools to get started. I'm pretty certain, I don't have the numbers, the exact numbers on me for how many they have. I know that they are getting started this week. That doesn't mean that they can vaccinate everybody this week. I don't believe that they have the supply to get anywhere near that, but they are getting started with vaccinating teachers. I want to clarify a couple of other things related to that. That's that when we first got the initial shipments, that they were coming to the county and we were filtering out. Now Mark Twain is able to put in their own orders, right? And the same is happening with CVS and Walgreens. Other medical providers will be putting in their own orders. So that means there's a lot of competition for what's being shipped. I mean, it's all coming to our residents one way or another, but it does make things a little confusing as to what we're going to get, how many we're going to get, when we're going to get them. And it's why we're trying to maintain as much structure as we can within those tiers. But you can understand how that makes it really difficult to, you know, do one segment first, then move on to the next segment. We're trying to do that as much as we can, but inside of those tiers, it does get really difficult, especially when you mix, you know, the federal contract with CVS and Walgreens, with what Mark Twain is able to do with the 65 and over populations. And then for us, with our limited supply, doing what we can within the same tier, with the folks that we're able to work with outside of that 65 plus population. So it's kind of a lot of trains running at the same time that we're doing our best to coordinate. And I understand that, you know, creates some confusion for the public and frankly drives a lot of misinformation and some pretty wild accusations. So I would encourage people to listen to the board meetings if they want clarity. You know, we are doing press releases, listen to, you know, what Doug Archer is bringing. Try not to get too much of your news, you know, from sources that aren't vetted. And I know people know that, but there is a lot of misinformation floating around. And then if you don't hear it live, there are things that get twisted and distorted as well. You know, Doug had last week made a comment leading up to what he just said today, which is we're going to try to do 100 the first day. We're going to try to ramp up to about 250 at our peak, right? And then somehow that got twisted and flown around on social media that I had said that about public health, which I didn't say. We don't have the vaccine inventory at public health to be able to perform at that rate as of right now. Hopefully that'll change down the line, but that could be a month, that could be 2 months. I don't know. It depends on state distribution. Okay.
I guess, Mr. Leach, we're sort of looking for an incident commander, and there is none. But my question, before we let Supervisor Garamendi in, is what is it that public health is doing now? I understand what Mark Twain's doing. I understand what CBS is doing. What is it that public health is doing? And so we can have a clearer idea then of, and is some of this information going on the dashboard? And I think I'll try and make that my last question.
Well, some of this is my typical failure in presentation skills. So I turned it over to Doug because I wanted to get an update from him, and then I hadn't really finished going through. So once again, Chair Stopper and I kind of stopped the show in the middle of it, and I do have more information to cover. But I'll respond to that really quick. This week, Public Health is working on vaccinating a lot of the folks who got their first dose. So that's our EMTs, firefighters, public health direct staff, those kind of folks that are doing vaccinations and the first responders. They're getting it, their second dose this week. We're still working to complete the first round of Tier 1A. We're also supporting CCOE in getting their folks started in the vaccination process this week. So that's mainly what we're focused on this week.
Thank you.
And it really is week by week from there, Supervisor Callaway, depending on what our supply ends up looking like and what our allotment from the state comes in. I see 3 supervisor hands raised. So would you guys like me to go through and finish the other things I have, or do you want to keep talking vaccines and then I can finish with the other stuff?
Mr. Leach, let's go ahead and let you finish the rest of your presentation. My apologies, but Mr. Archer was ready for some questions, and then we'll get back to and we'll address all the questions of all the supervisors post you finishing that up.
Sure, and most of what I want to finish with, I did want to mention that testing, we are still testing, and it's still important. We've done, just for the public health testing sites, for the county public health, we've tested 460 people since December 23rd. So that's just the public health staff testing. That's not including the OptumServe sites. This week, let's see, we are offering testing at a variety of locations. This week we have 3 days of testing available. We have 2 in Ironstone. This is the only week we're doing it twice at Ironstone. I can't remember how we ended up with a bonus day, but today and Thursday we're testing at Ironstone in Murphy's. And then tomorrow there is testing in West Point at the community hall. That testing is free. Please, you don't need an appointment, but registration, pre-registration is strongly encouraged. We have had some pretty good turnouts at our testing locations. We're still in a surge. You guys know that. It does look like daily new cases hopefully are starting to plateau and tick down a little bit. Hopefully Doug's seeing the same things over there. But we're definitely still in the surge. We are still doing investigations and contact tracing. I just want to remind the community that prevention is still the best defense. It means wash your hands, wear a face covering, and practice physical distancing, right? If you're sick, please stay home. Please isolate from others. I mean, the best thing that you can do at home is, do your best to take the preventive measures to not get COVID right now, as far as getting us past this surge. So those things, I want to make sure that we keep stressing how important those are. And with that, I think I have covered most everything I need to cover, and I will stop and turn it over to more questions. Doug, did you want to piggyback on any of that? Did I cover?
Yeah, just on the actual COVID infection and I guess patient volume. So for the hospital, we've seen knocking on wood, we've seen a decline. We peaked just after the new year with 12 positive COVID inpatients. As a kind of a benchmark, our average daily census is 8.5. And we had 12 positive COVIDs with the full census of 16. That continued for about 4 days, and then we started to ramp back down. Today, I'm happy to report we have 4 COVID positive patients. So we've seen a pretty significant decline. 2 of those are in the ICU. 2 of them are on our general med surg floor. So for, for our kind of state metric of ICU capacity, we have 3 total patients in our 8-bed ICU. So we're a little better than 50% capacity. So we're doing pretty well. We have a full total census today in the hospital of 12. And again, 4 of those are COVID positive. So, yeah, encouraging, especially for our staff. They were, they were busy in the beginning of the year.
Thank you, Mr. Archer. Thank you, Mr. Leach. Supervisor Garamendi, you've had your hand up for a while.
Thank you very much, Mr. Ben. Appreciate it. First off, I'm really quite pleased about this partnership. It's been we've been partnering for a long time. I think we've just gone to a new level, working literally hand in glove. So thank you very much, Doug, and thank you, Sam, for putting that together. I think that's very wise. And Dignity and Mark Twain, they've got a lot of resources. So working together, we're going to get things done. My one question, and thanks also for mentioning earlier the issues with some of our Foothill Village and other places, Sam. That is a real concern. And if CVS and the federal government and state government can't figure it out, these are our people, and we have to figure out a way to protect them. And we might just have to figure out how to do that. Maria asked my primary question, so my question is going to be, for when we've 1A is being done by the county, so taking care of all of that. Phase 1B and now the expanded 1B under the governor's direction. That's all going to be Dignity. That's all going to be Mark Twain. So is there a single point of contact? Or are we working bifurcated, or who do we tell people to call?
That's a good question, Sam. We'll probably have to team up on this one. So I don't believe the design was for Mark Twain to handle or to take care of all of 1B. There are multi-layers in 1B. And I think what we stepped up for Mark Twain, what we wanted to step up and do is provide the vaccine for those that can kind of come into the clinic a little more ambulatory. And that frees up public health to be able to go to sites or to, for instance, us going into Avalon to provide vaccines probably doesn't make as much sense, or going to the, to the jail or to the correctional facilities, things like that. So I think I would say we're partnering on the 1B so that we can move through it a little quicker. That's a huge portion of our population. So, sure. Sam, I don't know if you have any comments to add there.
Yeah, well, look, when you moved 65 and over, Mark Twain had agreed to take on 75 and over. And then in the blink of an eye, the state makes the decision, and some of that, not to blame the state for everything, some of the state's good intent on that, their noble intent behind that was they knew that they had to open things up because there were some places that wanted to vaccinate more and were moving somewhat quickly and still had vaccines on hand. That was the exception, but there were some places that were being held up because the tiers were too restrictive. But then they kind of opened it up so much, and we're lucky to have the partnership that we have with Mark Twain, who is willing to, keep their hand raised and step up for the 65 and over, which is a much, much heavier lift, as you know from the numbers that I stated last week. So for us to clarify, Supervisor Garamendi, to respond to your question, we plan to keep working through the other segments of 1B. We're still finishing up 1A and the second doses there. As we have more coming into public health that we have to use, we'll be working kind of simultaneously to Mark Twain working with the 65 and over. We'll be looking at other segments of Tier 1B. But Tier 1B, in the way that it's structured right now, while I can't give you an exact timetable, nobody can, it's going to take us a while to work through 1B.
Absolutely. I was just looking for a point of contact, a number, and Doug mentioned 3,000 phone calls. I can't imagine how you guys are going to sort through that. But, having that one filter is going to make it a lot smoother down the road, because it's just going to get crazier before I get some more say.
Yeah, for sure. And we are not in a position at Calaveras County Public Health to be able to start taking appointments for other groups in 1B. Right now, we're still reaching out to groups. We have a very limited supply, and we'll get rolling as we go. But right now, until the supply is significantly increased, that's where we are. Okay.
Yeah, I would imagine, the 65 and over, non-ag worker, just the general 65 and over group of 1B is going to take us months, literally months to get through. And I would imagine if the county finishes, the more esoteric 1B categories, we'll probably merge together on the 65 and overs at a certain point in the future. It is a little confusing, but and I don't know that we need to give this direction. From the amount of phone calls we've had, people aren't bashful. They're calling. But I would encourage, if you're not associated with, an entity, a public entity, a large employer in the food ag world or something like that, if you're a 70-year-old resident of Calaveras County, call our phone number and try to get scheduled. I think that's the best direction we can give. If you're in that 65 and over tier, and not otherwise affiliated with some type of a, essential worker operation, I would point them our direction.
Thank you. And thank you very much, Sam, for putting a team up in West Point testing tomorrow. It's a long drive for those guys to get over to Sonora. So thank you. That's all I have, Mr. Chair.
Thank you, Mr. Carmody. Ms. Foldorf.
I had a question about the second dosage. Can you, I don't know if to Sam or Doug, could you clarify a little bit more on the inventory and the second dosages that are going to be coming out?
Sure. Sam, I'll dive in. You can follow up if you have any other comments. So that's really where the supply chain issue comes into play. We just gave the first doses yesterday for this tier 1B crowd. So that gives us, 4 weeks essentially from yesterday before that second dose is due. So we are counting on additional shipments to be able to provide that second dose. So, there is some, I guess there's a little bit of a fragile element to the supply chain at this point. But I do believe, as mentioned earlier, 1.5 to 2 weeks from now, we should be in a much different position with supply chain. So I'm personally, I'm an optimistic kind of guy. I'm not concerned about those second doses coming up in 4 weeks. So I'm confident we'll get the supply necessary to be able to provide those second doses.
Yeah, nothing to add. It's consistent with what Doug just said. I will, just to assure the public, the majority of people in the medical community, the majority of people in the know, knew that this was going to take several months to ramp up. And I know that, the worst thing you can do is overpromise and underdeliver, right? And there were some overpromises made in the media. I'm not blaming any one in particular, but a lot of rumors get floated around, whether it's on social media or by people just trying to make things sound more expeditious than they are. And frankly, we were pretty sure that this was going to take a couple of months to get the heavier lift done and to wait for inventory to catch up. And then hopefully toward the end of March into April, things will start really humming along. The general public, again, just to remind you, by the time we get down to the general public, it's going to be this summer. And it could be into late summer before we get to that point. And even I don't know that. Like, so many people don't really know that. We're just giving you a rough time frame. Could that mean August? Could that mean September? Nobody really knows for sure. I'm trying to be optimistic, like Doug is. Doug's probably more optimistic than I am, but he also knows more than I do. So maybe by June. But we don't know. And we just ask for people to be as patient as you can. Understand that we're really working hard to bring you this information. And one of the changes that's really probably been obvious to some people is that we're trying to give you as much information as we get it, as accurately as we can. And sometimes when we're that transparent and then something changes the next day, it looks like we gave you misinformation. And that's not our intention. Our intention is to respond to what we are asked by the public through the esteemed members of the board, which is tell us something. Tell us something. Tell us what you know. I mean, I heard it over and over in my first few weeks here. And so, in our defense, that's what we're trying to do. We're trying to get you as much information as accurately as we can, as expeditiously as we can. And we'll continue with that strategy, even at the risk of having things change an hour after I say them.
Thank you, Mr. Leach. Ms. Foldorf, do you have anything else? Not this time? Thank you. Mr. Toffanelli, thank you for waiting patiently.
Thank you, Mr. Chair. I appreciate it. And thank you, Dr. Archer and Mr. Leach, for all the information. You've partnered together and done this well. A lot of my questions were asked by the other supervisors, great questions, but I do have a couple of questions I need to ask. And one of them has to do with CVS. I understand they're under contract with the federal government, but do we, as a county, do you, Sam, or Dr. Archer, do either one of you have any contact with CVS on what their plans are, or any communication at all with them? And if you don't, can we reach out to them so we know, because these are our constituents in these long-term care facilities, and I'm sure they're wondering what's going on and what's happening, and if we can at least partnership somewhat with CVS, if it's just for communication on where they're going. And then the other question had to do with, because they've only done one, is it a possibility that this vaccine that creates a great inaction to it that we pulled off the shelf, could that be part of the reason why they've delayed the other facilities?
Sorry. Thank you, Supervisor Tuffanelli. I think you win the kindergarten award for having waited patiently the longest with your hand up today. As far as CVS, yes, we have reached out to them. We don't have, it's not like it's Mark Twain where we have a close working partnership. We need to get a hold of people, regionally, and then I'm sure that gets sent up. It's a huge national chain, right? So we did reach out to someone in their region on Friday when I started getting a few inquiries about what's going on, the skilled nursing and the long-term care facilities. So we have reached out to them. We haven't heard back yet, but I also please understand that the California Department of Public Health is also looking into this with CVS. So my assumption is this is a much bigger, statewide, potentially nationwide issue that's probably happening well above, my level as interim director of, Health and Human Services here in Calaveras County. Not to minimize what I do, but obviously that's a huge contract. So hopefully we will get clarification. My deputy director is actually on a call with CDPH right now because I was scheduled to be here, so I'm not on that call. She's covering that for me, so maybe we'll hear something. If we do get information, we'll pass it along. As far as whether anything with any of the pharmaceutical companies impacted that slowdown or whatever it is, I won't speculate to that. I don't have any information on that. It's a good question.
Okay.
More than 300,000 doses that have been held from what Doug says, obviously it begs that question, but I don't know that. So I won't speculate. I don't know what CVS is up to.
Well, thank you. And if you knew, I don't expect you to speculate at all. That wouldn't be advisable. I have one last question, and it has to do with people that have had the virus and recovered, or are in a facility like we have 4 in the hospital right now? Are they able to get, or should you sign up to get a vaccination if you had previously had this virus and then you recovered from it? Do we know if you can get it again, or should you get vaccinated?
So, and just to be clear, this is my disclaimer. I'm not a clinician, so I only play one on TV. So the guidance we've received from Dignity Health is that if you should still get the vaccine even if you've recovered from COVID-19. There is evidence of reinfections. Not widespread. It's not extremely common, but I don't think they know. I mean, this disease is only a year old for us. So the general direction right now is that even if you are recovered from COVID-19, you should still seek the vaccine.
And there is CDC guidance, and there is CDC guidance on that. I don't have it right in front of me, so I'd encourage people to go to the CDC frequently asked questions page, speak to your medical providers, get the advice that you need to get.
And I have one last question, and then I'm done. You mentioned CVS in the federal contract they have for long-term care facilities. However, there was some of the conversation about getting vaccinated at CVS. Can anybody get vaccinated at CVS if you go there, much like a flu shot? Or their only contract and the only doses they have is for long-term?
Well, I probably shouldn't speak for CVS, but I am pretty certain that you cannot just make, any general person out there cannot just make an appointment right now at CVS, okay? They're not at that point.
All right.
I'm sure they're focused on the contracts that they have. Right now, as frustrated as people are, if they're in the 65 and over category, they should be calling Mark Twain and leaving a message. Mark Twain will get back to them as they can, understand that the volume is massive. If they're not in that grouping, they're waiting to hear from us, and they're listening to communications that we give on a weekly or bi-weekly basis. I'm trying to be here every single time the board meets so that I can, steal the thunder from planning, who thought they had the spotlight today. These kind of things. So we'll try to provide as much clarity as often as we can. We've been doing press releases and media releases when we can. I've talked to Dakota at the Enterprise. We're trying to get as much information as we can out into our community, and we will continue with that strategy, okay? But right now, I understand that there are a lot of people who absolutely want the vaccine yesterday, and we've just got to be a little bit more patient, and we'll get it to you as we can. Okay, we're working through this strategically and equitably.
Thank you, Mr. Leach, for clarifying.
If you don't mind, I'll have a follow up here. It's good news to hear that, within possibly 15 minutes of you putting out this service announcement, close to 980 voicemails. It's always a grave concern whether we're being heard when we put out these public announcements, especially with something as crucial as this. So, Mr. Leach, you just followed up with the fact that you're going through so many different avenues trying to get the word out, and we appreciate that, and let's continue doing that moving forward. It's crucial that when we do want to get the word out, that we do it clearly and loudly and ring the tower bell as loudly as we can so that everyone can hear it. Consistently I hear this, and I mean, it's an issue across the nation, not much less the world. It is the supply and demand when it comes to the vaccines, as we move forward, we can only do as much as we have. you know, at that, you know, still, you know, every time you put an order, shoot for the stars. Hopefully we'll land on the moon, gentlemen. You know, I know you can only do so much, but you know, let's do everything we can. And I'm sure you already have, and I appreciate you following through with it. That said, you know, with the vaccines coming in slowly, this is man's way of building herd immunity through the vaccine. You know, and us being to the point where we can see the light at the end of the tunnel, possibly with COVID. So at this time, you know, and you brought it up already, Mr. Leach, when it came to the testing. It's still crucial that we're following through with that, you know, as much as possible. I just had my first 2 tests this weekend, both negative, thankfully. Nothing pleasurable, but at the same time, you know, something you said last week, Mr. Leach, you know, something that I wasn't ever looking forward to. I didn't want to become a statistic. At the same time, you know, after I got that negative result, there's a sense of relief. And that's something that you said when you got your shot from the vaccine. And, you know, so I can say that, you know, that's good. That's something good that you said last week that resounds with me, and I think that the rest of the public, you know, should keep that in mind. You know, Mr. Toffanelli brought up a very good point that I have down in here in my notes: coordination with CVS between, you know, when it comes out, and you know, keep beating that drum. Let's try to get out to them. Let's see if their corporate is willing to start working with the different counties. I mean, just let us know what's going on, you know, so that way, you know, if we know if there's a gap there that we could possibly fill, let's make that happen. So I appreciate that also. I don't, you know, I really want to thank the rest of the board. They really addressed all my questions. I just want to follow up with a few things, and thank you, Mr. Archer, and all your staff and everyone working with you. Also, Mr. Leach. I mean, it takes everyone. It takes you know, so to say, a village. So we appreciate you all coordinating and working together and coming to the point where it's like, you know, we're truly partners, and we aren't working against each other. And that's the type of coordination we need for the public here.